This is my first summer in D.C. So 2002, I'm a congresswoman.
As chair of the political science department at Howard University, Dr. Robbie Perry studies a range of issues, but one in particular is personal: the government's response to HIV, the virus that causes AIDS.
We have the power, we have the resources to do it. We just have to decide if we want to.
In the immediate metro area, nearly 27,000 people are currently living with HIV, including Dr. Perry.
And I've been able to live a mostly normal life even with HIV.
Dr. Perry was a junior in college when he tested positive. At the time, in 2003, the virus was no longer a virtual death sentence. Antiretroviral medicines were available, but some were too toxic. Dr. Perry was in and out of the hospital because his immune system was weakening and mental state waning.
I certainly remember that I never thought I would be in a relationship, never thought that I would get married, never thought that I would have sex again, and thought that, my life was, on its way to its expiration date.
Safer and more digestible medicines have been developed to suppress the virus since his diagnosis.
To be able to take this one a day is, on one hand, a blessing. On the other hand, it's a daily reminder that I have HIV.
A pill he must take each day for the rest of his life, or until there's a cure. A few miles away in Rockville, Maryland, a dose of hope. This biotech company believes it may be on the cusp of defeating HIV.
We're in it to win it.
Jeff Galvin is CEO of American Gene Technologies and oversees a team of molecular biologists who have developed a new cell and gene therapy product targeting HIV.
We're putting viruses into their bodies that are going to specific cells and that are making very, very specific changes in a targeted way.
With the Food and Drug Administration's approval, Galvin says his team took blood from a man with HIV to get his infected T cells. T cells usually fight off various infections in a person's body, but get hijacked by HIV, destroying a person's immune system. Galvin's team modified those T cells to make them resistant to HIV and put them back into the patient, which, if all goes as planned, should keep the virus from spreading.
We have learned so much about viruses, and specifically about HIV, that we can now crack them open, scoop out their disease software.
That first participant was infused with those modified T cells in June. Now, the FDA will see how he's responding and determine later this month if it's safe enough to move on with phase 1 of this trial, trying it on more patients.
Most drugs fall out of the development process because of adverse events. So in other words, the drug itself might actually work on the disease, but the problem may be that people can't tolerate the treatment itself.
So far, Galvin says that unidentified patient has not had any issues.
And that's huge.
Oh, absolutely.
Dr. Perry is a bit more guarded. He says for decades, those living with HIV have been promised a cure only to be disappointed.
I don't expect one in my lifetime.
In the meantime,
in my office, I've got a box of condoms.
He wants to keep talking about sexual health, the seriousness of HIV and its impact, no matter your age, gender, race, or background.
We all can be doing more to help ensure that this disease doesn't ravage another generation.